for joining, everybody, and thank you to the team at the door for hosting us this evening. Grace, you're down there, we see you. Thank you for that, and thank you for joining us for a very timely and important conversation, one that gets, I think, more timely every minute, every headline, right? My name is Alma Derricks, and I'm pleased to introduce my friend, my classmate, my line sister, my always doctor advisor, Dr. Bonita Coe. A little bit about Dr. Coe as we get started. Dr. Coe is a practicing internist and primary care physician with over 20 years of experience caring for adult patients in outpatient, nursing home, and hospital settings. She's practiced in private practice and group practice settings, and she's held clinical medical school faculty positions where she was responsible for teaching medical students and residents. She received her BA in Human Biology from Stanford University, go Cardinal, and her medical degree from Howard University College of Medicine. She did her internship and residency in internal medicine at the Cleveland Clinic in Cleveland, Ohio, and also holds an MBA in healthcare from Baldwin-Wallace College in Ohio. Since October 2023, she's been writing a monthly health newsletter posted on her website. That's besthealthforyourlife.com. I'll say it again, besthealthforyourlife.com. And in November 24, she published her first book, which brings us here today, How to Help Your Doctor Help You, a guide for men and women to manage health proactively, which brings us here tonight. So please help me warmly welcome my friend, Dr. Bonita Coe.
Thank you.
Now, while I've known Dr. Coe for decades, I was never more grateful for her wisdom, I have to say, during COVID. We were on a group text that kind of got all of us through the pandemic, and I'm sure you remember all the confusion, all the scariness. We tried to tamp it down, but it was a scary time. And Dr. Coe was always the proactive, straight talk voice of reason that we needed in the moment to just tamp things down. So it would start to spin out of control, and you were always there to go, nope, and in like 2 or 3 words, just shut it down. So it's the same with this book, right? It's a straight talk format that's approachable, that's easy to understand, and it represents what I think is so interesting, the collective wisdom of things you've learned, as well as what your patients have taught you, which I think is such an interesting and nice iterative circle, right? So it's all here, everything from blood pressure, diabetes, and wellness screenings, but even ergonomics and social media, things that you might not think are as straight ahead as some of those medical procedures, but it's really holistic that way. And as a non-medical professional, I really appreciate the way you see this through our eyes. So thank you for that. Thank you for your empathy and for your patience with us, and the ability to see that. So let's jump in. The first thing I want to ask you about is this cover, actually. So I think it's available. You can see it there on the side. I'll also let the doctor help you. Tell me about this cover. Let's just even start there before I even open the book. Tell me more about this cover.
So my idea for the cover came from my idea for the book, because my idea for the book and how a doctor should take care of patients is that the patient should be the driver of their care instead of the other way around, where the doctor was just saying do this, do that, and the patient is just this compliant person. And so my idea for the cover was to convey the idea that the patient is guiding the doctor in their care. And so actually, I had a dream that gave me the idea for the cover. And so the dream was the patient was standing on stairs and looking back, grabbing for the doctor and guiding the doctor up the stairs. And so that's how I came up with the cover. And so I actually woke up from the dream, and in my former life, before I became a doctor, I actually used to draw. And so I woke up, got a notepad, and I sketched out
This picture.
the idea for the picture. And so I sent that to my publisher's graphics team, and I actually, at the same time, was learning how to use AI. So cover, and that's what they came up with, and it came out great.
Yeah, it's exactly that. It's the patient reaching for the doctor. It's beautiful. I mean, tell me more about, and you talk about this at the beginning of the book. You talk about how this came about as you were sort of collecting these snippets of information and taking notes on sticky notes and in a little pocket pad. Tell us some more about the genesis of that, because I think it's really interesting. You didn't just sit down one day with a blank page and start this.
Right, so the initial title of the book was Pearls from My Patients. And so the way that came about was, when you're taking care of patients, patients are very, of course, very smart people, and often patients tell you things that are very, very smart, very perceptive. And I would say, can I write this down? Because I need so many of my other patients to hear what you just said to me. Of course, everyone said yes. And so it started out as little sticky notes in my white coat, and I started collecting them, and then it progressed to being on a document. And so the initial title was Pearls from My Patients, and then it kind of progressed to, over the course of 15 years, talking to my patients and telling my patients things that they should know but they didn't know, like know your family history. When you come to the doctor, bring your medicine bottles. Knowing why it's important to have your medical records when you come to see a new doctor. And I would tell people things and they would say, you know, I never thought of that. And me as a doctor, I'm like, that should be obvious. But to people, it's not obvious. And so two things, people would say to me when I would be telling them things, they would say, why has no one ever told me this before? And after a while I would say, well, I don't know. It's not written down anywhere. And then it was kind of frustration, like, why isn't this written down anywhere? And that's how it merged from Pearls from My Patients to how to help your doctor help you, how to come to the doctor instead of being a passive participant in your care, being an active participant in your care, so you can have better health outcomes when you come to the doctor with the information that you need to help your doctor.
So in those conversations with your patients, what were some of the most common things you heard? So medical records were one, not really realizing I should have a clean medical history to be able to bring that. What were the other things that you heard, and what surprised you the most?
Well, a lot of people don't even know their medical history. Some people,
family history,
no,
their personal.
Their own medical history. Like, I had my ovary removed, left side or right side. I don't remember. I've had people who think they've had a hysterectomy, but they didn't have a hysterectomy. They've had surgeries, they don't know what kind of surgery. Knowing who the surgeon was, where it was done, why it was done, what you've been diagnosed with, why you're on the medicines that you're taking, what your medicines are. Just things that you would think that people know, but they don't. They can't articulate it when they come to the primary or come to any doctor.
I mean, do you think it has something to do with the trauma and blocking it out? That people don't want to think about something negative with their own history? And so it happened, I'm just trying to forget that happened, I'm trying to move on. Is it as simple as that?
I think that's part of it, but I think people don't think it's important. I think, and so I try to impress upon people in the book that it is important, and by you knowing that, it helps your doctor take better care of you. So, for example, now within the age of computers, patients come to the doctor and I'm asking them about their history and they say, well, isn't it in the computer? But people are not aware that healthcare setting, healthcare computers, they don't talk to each other. Patients don't know that. So I have to explain to people. If you're at this hospital on this side of town, that doesn't mean that it talks to the computer on the other side of town. And if your doctor is not savvy enough to know that sometimes there's a way to make them talk to each other, if they can, they cannot just do that automatically. And I even tell my family members, even though we're used to having computers now, when you get things done, still have paper copies of your medical records, because sometimes hospitals change their electronic medical record. You can't get into it, you don't have access to your records. And so that's a big thing about knowing your medical history. And the other big one is knowing your family history.
Say more about that. That's a really interesting one because people don't have that, because they've never asked those questions.
Well, the first thing is, we all know our family members. They don't want to talk about what they have. They will take it to the grave. They don't think it's important to talk about what they have. They don't like to communicate the illnesses that they have. But it's so important to know your family history, especially in these days and times of genetic testing. It's important to know your family history, because in my current position, we do order a lot of genetic testing, and a lot of patients need genetic testing just based on their family history. Who had cancer, what kind of cancer, what age they were diagnosed. And so I encourage people to talk to their family about what diseases they have, what they had, give them talking points if they don't want to talk about it. So I tell people, tell your family members, tell me about what medical illnesses you have for the kids. The kids need to know.
things you've heard or learned, or maybe, you're not, they didn't ask you, but you might have opinions about things that you've heard that would be helpful to your colleagues to know how to approach us.
To be honest, no. Colleagues that I work closely with, honestly, colleagues that I work closely with, we're kind of like the same ilk. So we're kind of alike. And as a primary care physician, I tend to refer to doctors who over the years I feel are kind of like me. So over the years I've it's kind of like a bias that I have in my network where, so if I refer a patient to someone and I kind of don't get a feel, then I won't, maybe that's a doctor I don't refer people to.
If they don't share your ethos about empowering the patient.
Oh, absolutely, absolutely. So when I'm in a practice, I have a list of my preferred specialists that I like. Absolutely. And some doctors don't make the cut.
I'm not gonna name any names.
No.
But it's an interesting point too, as another tip, any referrals you can get from a doctor that you like and that you respect and that you work with well. It's interesting, it's a great point that you would keep people in your network that share your view.
Absolutely.
And so take that seriously, take the time to ask a doctor for a referral to another specialist. And take that seriously if you like the vibe you're getting from the relationship that you have, that's another tip.
And conversely, if I have a patient who, say, is seeing a specialist that in my mind is not really up to my standard, I don't tell the patient, but I may gently say, how about you get a second opinion from Dr. Schultz?
From one of, in your network.
And somebody that, people know what that means.
Just take a second look.
Without me saying
Without
anything.
saying, yeah, I like that. So, talk about the most common mistakes that we all make. If you could just wave along, what are the things that we do that make you roll your eyes and talk to yourself in the car at the end of the day? I know that's where you recorded some of these things too, where you just had to vent. What are some of those mistakes that frustrate you the most, and what can we do? What's the simple to do?
So that was part of the transition of the book to how to help your doctor help you. Because by that time, it was 2019, and then 2020 was rolling around, and then we were in the trenches of the primary care doctor. And some days, by then I had a document, and I had categorized all those sticky pads, and I had chapters, and I would sometimes leave the office, and I would just be frustrated, and I was dictating into my phone, into the software in the phone, and then at some point I had to change those rantings into a readable book that is the final product now. But just the things that I've mentioned now about people not knowing what's going on with their health, and I guess a big thing is patients not following instructions as they're given, or people not just not following the instructions, but not letting me know if they're not following the instructions. Because a lot of times people don't follow the doctor's instructions, but there may be a reason why. And there may be a simple modification I can make because of their reason. I prescribe a medicine, simple thing, you have a side effect, and maybe a simple modification or a change of medicine. I was like, why didn't you call me? Or the converse, you suffered without letting me know. It's like, why are you suffering? All you had to do was let me know. Or now these days you can send a message to the portal, and we have our nurses to help us with the bazillion messages that we get. It's communicate with your doctor. That, I guess people don't think of that, not communicating with their doctor. And I guess another thing is when
how do you communicate back to the communication?
So the big thing is people will have a symptom. Say you have a pain in your leg and you come to the doctor and the doctor says, an obvious question, when did your leg pain start? And you say, oh, it started 2 weeks ago. But, you know, make a long story short, what people make the mistake of doing is telling about their immediate concern, their immediate symptom, and they don't remember or they don't think it's important to tell the doctor that that leg pain actually started 6 months ago, not 2 weeks ago. And, you know, they don't make that connection that that 6 months ago pain gives me a whole another list of diagnoses that it could be versus if your pain started 6 weeks ago or 2 weeks ago. And so the point is that people often decide what's important to tell the doctor and they decide what's not important to tell the doctor. And so it's always important. Tell the doctor everything, even if you don't think it's important, because that little piece of information that you think is not important could be that very little piece of information that helps me figure out what's wrong with you.
And that there's another piece of suggestion, not only the communication, but write this down. Journal it, put it in your phone,
Yes.
make a little note, but capture the date, you know,
Yes.
make a note to yourself.
So how I describe that to people is called a symptom diary. If you have a new symptom, start writing it down. When did it start? How long does it last? What's the pattern? And so very often if a patient has a symptom that is kind of vague, I can't figure it out, I'll say, let's start a symptom journal. Let's see what it is in 3 weeks, 4 weeks. Because a lot of times, once you start writing down a pattern of the symptom, by the time the patient comes back, they have sometimes figured out what it is because they're paying attention to the pattern of a symptom. So people, you know, as a non-patient, as a lay person, you don't think of symptoms the same way that a doctor does. And so that's a common mistake, if you will, that people make in thinking about a symptom. And lastly, say you have chest pain today or 2 weeks ago and the chest pain went away. Oh, the chest pain went away, so I must be okay. Just because the pain is gone doesn't mean you're okay.
Yeah, that's great advice. So communicate and write it down. Keep that journal, keep that diary, put it somewhere where you can get it so that you can have access to it. And then the third tip is having a larger family history. Once you do it, it's an investment of time, but once you do it, you have it now.
And yes, and knowing that family history may change how your doctor manages you going forward.
So let's turn to chronic conditions. So these are things, we're talking about episodic things a little bit, but let's talk about people who deal with chronic conditions. You have a lot of advice in your book about that. What are some of the things that are key takeaways about managing chronic conditions for yourself and probably for people around you and for loved ones?
So I spent a lot of time in this book on the big three. I call it the big three. High blood pressure, diabetes, and high cholesterol. Those are the big three. So I spent a lot of time on that, and the corollary to that, I spent a lot of time on eating healthy. Don't hate people about exercise because you can, a lot of times for a lot of chronic conditions, even outside of the big three, you can do a lot by changing eating habits, even without exercise.
Even if it's genetic, even if some of those things are genetic.
Even if some of those things are genetic, keeping in mind that you can't do anything about genetics, but you can make things better. So chronic conditions, some of the same things that we're talking about, diaries, monitoring symptoms, knowing your medicines, following your doctor's recommendations about how you should eat, which I spent a lot of time in the book about food, changing your relationship with food, because you gotta look at food. I used to say food is medicine, but I was corrected by our obesity medicine specialist, and they say food as medicine. Because, what I do say is you can look at food and decide you're gonna eat the good medicine, and you can decide you're gonna eat the bad medicine. Because we all have to eat something. And so for a lot of chronic conditions, making those healthy food choices is very healthy. Then of course exercise, and then following your doctor's recommendations. And I will say, it's not all doom and gloom. Trying to have a positive outlook, because many chronic conditions, ultimately, they're not your fault. You didn't cause them. Yes, there are things you can do to make them happen sooner in life. You can do things to make them worse, but try to have a positive outlook about things. And I also spend a lot of time talking about mental health, which is a chronic condition.
Let's talk about that. I was just about to say that your outlook on your condition means so much. And you spend time in this book talking about mental health and perspective and outlook and optimism, but not blind optimism. That's also another pole that you talk about. I'm just gonna let God take care of it. It's gonna be fine. That's the other pole of this.
Oh yes, that's my chapter. I think the chapter is called I'm Not Gonna Claim It. Because if I had $1 for every time I've heard I'm not gonna claim it, I could retire right now. And my response to people is, I think I said that in the book, you might not claim it, but it can claim you.
Right.
And I will say at this juncture, this book is not about medication at all. In fact, I don't mention medication at all, except one group of medications that we use for depression and anxiety. I do list those in case people are taking any of those medications, because a big part of the book is to encourage people, if you have mental health concerns, if you don't manage what's going on here, you can't really pay attention to anything else that's going on with your health. As a primary care physician, we always have a heightened sense of who needs a referral to see a mental health specialist to help us. I've spent a lot of time in my career helping people lose weight long before the weight loss medicines. Because if you're eating the wrong things or eating for reasons other than hunger, sometimes seeing a mental health professional gets people out of that into a healthier eating pattern. And with this age of the weight loss medicines, what I do say is the weight loss, they're not magic medications. They, in a nutshell, they decrease your drive to eat. But if your reason for living, your reason for being, if your part of your life every day is that eating, the weight loss medicines take that away.
And now you're left with nothing, sort of nowhere.
And so that's also a mental health issue. So I've had patients schedule appointments with me to talk about taking weight loss medicines. And when I say that's what the medicines do, they don't want to take the medicine because they don't want that taken away from them.
Share a little bit more about your chapter 30. We talked about this before, and it's related, but it's not about the initial state of mind, but it's the way you reflect on your life and your life choices and how that impacts mental health. I think that's so interesting and such a broader lens on exactly what you're talking about.
So another big concept in my book is about choices that you make. And when I say choices as a doctor, it's not just about medical choices, because there are lots of choices that people make in their life that leads into the doctor's visit, like where you choose to live, what job you choose, who you choose to raise your kids, how you treat people in your life. That's a big one, how you treat people in your life. And so, not to, be down on, what happens in your life, because lots of things happen in your life that you don't have control over, but a lot of things happen in your life where you're on a journey and you chose to go this way instead of this way. And a lot of times, like when you're on one journey, you cannot take that back. And so, I don't remember how this term popped in my head, but the term is regretitis. And so, can someone in the audience tell me what they think regretitis means before I tell you? What is regretitis?
Wish I coulda, shoulda. Wish I coulda, shoulda.
There you go. Woulda, coulda, shoulda. In fact, that was almost going to be the second name of that chapter. Woulda, coulda, shoulda. And so it is a very serious condition. It is very insidious. It's a very haunting condition, and it can really take up a lot of people's time and affect their health and how I take care of them, because people can ruminate on choices that they've made in life. And there's choices that you could have made 10 years ago, 20 years ago, that's still affecting you later on in life. And a lot of times we have to deal with that in the doctor's office. And there's another chapter, I call it, that's my favorite chapter, called Through the Decades. And so what it is, I call it, that's my crystal ball chapter, where I write about, in my experience, what happens, what kind of group of experiences people have in each decade of life, to kind of give you a glimpse on the things to look forward to and plan for that starts happening in your life, like in your 30s, raising children, or in your 40s, when you start 50s, when you start taking care of aging parents, and certain medical conditions start to happen at different decades in your life, and when people start jobs, when people end jobs and start new careers, and these are things that are not necessarily medical things, but they affect your health. And a lot of times, if you can look forward in your life and plan ahead, even mentally be prepared for these things, a lot of times you can have a better outlook in life as you're going through the decades. That's the name of the chapter. So that's what regretitis is about, making choices proactively, thinking about the choices that you make in life before you have to regret them.
And I have to imagine that that reduces your sense of confidence, your sense of agency, if you have those regrets.
It's very,
It undermines them.
it's very, very insidious. It's very pervasive. Sometimes it can be a very overwhelming thing for a lot of people when they make choices in life that they can't take back. Relationships didn't go to it could be anything in life.
And it's haunting.
It can be very haunting. And you have to address it. Same thing, if you don't deal with what's going on up here, it's hard to deal with what the doctor is telling you. It's hard to deal with what's going on with your health.
So with that, let's talk about trying to make sense of all the medical information in the world right now. It's always been hard. I think it's harder, because I think almost every day there's a new headline. We'll go over some of those headlines before we get out of here. But let's start at the beginning of how do you even begin? So we've talked about maintaining your own history, keeping your own records, or the things that you can control. Now you're just trying to take a look at the world and the headlines and make sense of it. Where do you start? What's your advice on how to wade through all that information and misinformation that's readily available?
So I always tell people, start with your doctor, especially these days. that, don't Google symptoms. You will be going down a very tenuous path if you do that. But if you're going to look things up on the internet, start with trusted places. And I tell people to start with like university and health system websites. Like I trained at the Cleveland Clinic, or Johns Hopkins, or Mayo Clinic, or Howard University, or Emory, or Morehouse School of Medicine. A lot of these large universities have websites that have patient information that's peer reviewed. And so for peer reviewed means that somebody has written something, a doctor has written something, and another doctor or professional has reviewed it, and it also gets updated when new information comes out. So I tell people to look at those kinds of websites. And there's another website that's very good, it's called Helplines, HEALTHLINES, Helplines.
Like a spelling bee. You got it.
Healthlines.com. That is a very, healthline.com, not without the S. That's a very good website. It's written for lay people to understand. It's peer-reviewed information that you can look at. And also, professional medical societies like American Medical Association, National Medical Association, American Cancer Society. Those professional societies and organizations have trusted information that's updated, especially now. And I will say, right now, I was just at a conference this past, 4 days ago for the National Medical Association. The information that's on the FDA website and the CDC, so Food and Drug Administration, Center for Disease Control, I'm not even gonna look at that information. It's incorrect, it's not based in science anymore. As a physician, I'm following guidelines of my own professional organizations. And we talked about this at our conference, at our NMA conference. The FDA website and the CDC website, we can't trust that anymore. And there's physicians in the audience that are shaking their heads.
Are those sites meant for lay people? So those peer-reviewed journal articles and some of the things that you're talking about at those sites, are they built for us? As non-medical professionals, are those sites relevant for us?
So the CDC website and the FDA website, they do have patient sections, yes, they do. But they're taking down, they are taking down information from those websites that were up last week. That, yes, so so I don't recommend looking at those anymore. For the next 3.5 years. until it gets-
Good.
So stick to the major medical institutions, stick to the national associations for specialists. That's your advice.
Yes.
Stay there. So we're gonna take a pause to see if there are any questions. Oh, is that you?
Yes.
Any questions? I heard a lot of reaction to the point about the CDC and FDA right now. It's a little frightening. The things that we could take for granted as sources of information are not there right now. The questions.
You got kind of quiet, people are thinking now.
Yeah.
I just want to say something, not really a question, but it's like when you say, don't pay attention to the FDA or the CDC, and I get it because I'm a physician, but that's a
basically, one of the doctors in the audience is pointing out that, you know, we've spent most of our lives trusting FDA and CDC, and it's a hard switch to make right now, especially since just a few years ago, CDC was the center of the world when it came to COVID advice and COVID information, so we were taught, pay attention to the CDC, and now to make that switch is just not that easy to cut over that way. But you're saying replace it with information that's more reliable.
I agree, except for the last couple of weeks when I've been on the CDC website looking for something, and I'm looking for something specific. And a lot of times when I look things up on the internet, I have an idea of what the answer is. I would just want confirmation. But when I'm on the CDC website, and when two things, something was there and it's not there anymore, I didn't like that. And number two, I see something that I know is wrong. So that cured me of that within the last couple of weeks.
Other questions or comments? Got people thinking, I think you're right.
Honestly, have you, well, congratulations on your book, first of all.
Thank you.
And then, have you shared your book with, your patients or parts of your book with your patients up until now? And what's their reception, or have you seen, how have you seen this reflect back in your practice?
I'll repeat the question so it's on tape. Have you shared the book with your patients, and how do you see, and have they had any feedback that's reflected back to you?
So, I had my first in-person book event was on March 1st, 2025 in Washington DC at Coe-How Video and Books. And so I had patients there who came and had me sign their books. And so I've gotten feedback that way. And I have had patients reach out to me through my website, that's healthforyourlife.com, and on LinkedIn. Former patients have reached out to me. So I have heard from my former patients about my book. They have read.
Did anything surprise you that you heard from them?
Well, you know, it's kind of same kind of bias type of thing. Patients who would do
Of
that,
yours.
patients of mine who would do that, they're already motivated anyway. So no.
Okay, fair enough. Fair enough. Any other questions? All right.
No, nobody has any questions about vaccines? I suggest that. What vaccines they should be getting right now?
Well, let's do that speed round, because I do want to go through some of the headlines.
Okay.
So let's start with headline number one, vaccines. We're in booster season. Oh, is there a question?
Oh, no, I was just gonna make a comment. I liked what you said about, knowing your family history and such. And, you know, unfortunately, the elders that have passed on, I didn't ask, but I knew on my father's side anyway, I knew about things, and I have an elder cousin that knows everything. So it is very helpful, and the doctors are very appreciative of the information that I can give. So I'm just saying, I'm doing that right already. So.
So pat us up on the back.
And pass on that information on to your children and grandchildren.
Right. So, so I appreciate that. I do wonder, but maybe you're gonna get to this, on medications and such. You know how now everybody's trying to do the natural thing or go with herbs and things like that. And for me, fortunately, I have a pharmacist that calls like every 3 months, goes over what I'm taking, and then I interject and say, hey, now I want to try turmeric, or I want to put this in my, you know. And so the pharmacist can tell you, like for instance, in my case, turmeric would be good because it has the property of like a blood thinner and aspirin. But, you know, things like that. But I'm saying, do you get a lot of that from your patients that are saying, oh, I want to Hey, I just, you know, out there, but I'm saying, we hear so much now, they use, you know, making your blood glucose go down, what is it, berberine and cinnamon and something.
Berberine, cinnamon.
Yeah.
So I'll just repeat the question. So first, a shout out to say you are doing the right thing to gather your family health information, so we appreciate that comment. But the question is about natural supplements and things like that outside of doctor prescribed medications. How do you make sense of those things? How do you know, and how do you make the right decisions when it comes to other non-prescription drugs?
Well, I encourage patients to, when they're telling me their medicine, I ask about supplements as well. And what I tell, this is what I say. If your body didn't make it, it's not natural. Anything that you take from the environment outside of your body, when you take it in, that's not natural. Like I remember in medical school, Howard University College of Medicine, shout out. We got some graduates in here. I had a patient who made dandelion tea from dandelion from her yard and ended up in kidney failure, ended up on dialysis. So just because something is in the environment doesn't mean it's right for you. So anything in the environment can be foreign to your body, foreign to your immune system. So I encourage people to, even supplements, you should discuss with your doctor whether you should take it. You know, for a lot of things, it's usually okay, but sometimes it's not by itself, or it may interact with the medication you're taking, or it may interact with another supplement that you're taking.
Any others? Yes, sir.
How do we develop confidence in a doctor, and how much confidence should we actually place in the doctor?
So the question is, how do you develop confidence in a doctor, and how much confidence should you give to them?
So I get that question a lot, and I think it just comes down to the doctor-patient relationship, which, as a primary care physician, I feel fortunate that, as opposed to a specialist, you have a lot of time to develop that relationship with your primary care doctor. And so, I think, when you're not a doctor, how do you know what your doctor is saying is correct? But, you still can have a feeling if your doctor is listening to you in the sense that they are listening to you and answering the questions to your satisfaction. Little things like responding to your phone calls, and sometimes it comes down, sometimes it's not just the doctor's office. Responds to your questions, responding to all the care that you need. And so it's the kind of thing that has to develop over time. And so I think going back to the premise of the book is that I'm putting the onus on the patient as well as the doctor to develop that relationship. And so that's where communication comes in. Communicating with your doctor, because the better you can communicate with your doctor and be more active in your care, the better your doctor can take care of you. And I do talk about in the book, if you are in a doctor-patient relationship where you don't feel that, you shouldn't pick another doctor. You should not feel that you have to stay with a doctor if you don't have that confidence. You should find somebody else.
Good point. Other questions? All right, so before we wrap, we promised a speed round on some of those headlines, so we're gonna go. And vaccines, number one, this is vaccine season, flu shot season, COVID booster season, and we're getting all sorts of information. Tell us.
Talk to some states with respect to the COVID-19 vaccine, like in Maryland, you don't have to go through a lot of hoops to get your COVID-19 vaccine. You can just go to the pharmacy and get it. District of Columbia, I have a license in District of Columbia and Virginia and Maryland and other states. But District of Columbia and Virginia has sent out emails saying to get around what the FDA has said, that people under age 65, they're not saying that you should get a COVID-19 vaccine. They're saying get a prescription from your doctor to get your COVID-19 vaccine. Maryland, you don't have to do that. And so it depends on what state you're in, whether you can get your COVID-19 without a prescription from your doctor. As far as childhood vaccines, and if you're pregnant, talk to your doctor, because a lot of the professional organizations do not agree with what the FDA is saying. And if you go on the AMA website, American Medical Association, the National Medical Association, that's the national organization for Black doctors, our policy statements, our press releases, they're all on there, clear as day, that we don't agree. And I put this in a social media post when I was posting about being at that medical conference on Wednesday. If your doctor tells you something that doesn't sound right, go with your gut. You gotta pick another doctor, because unfortunately there are doctors out here that are practicing not based on science, they're going to be practicing based on ideology.
Headline of the week, Tylenol, autism, and pregnancy.
We just talked about that on Wednesday too at the NMA conference. So, in short, once again, I'm like, why is this coming up again? So, the research where the myth about autism and Tylenol, I'm going to go autism and vaccines, Tylenol, was faulty, fraudulent, and the doctor who did it, he ended up going to jail over that. So that's the autism and the vaccine. The science, there's no definitive science about taking acetaminophen.
Okay,
Could you repeat that?
And pregnancy. And I will say this, you may have heard this before, correlation does not mean causation. If two things are correlated, that doesn't mean that one is causing the other. But so far, we don't think it is unsafe for pregnant women to use Tylenol, well, acetaminophen, for enduring pregnancy. And the other issue is Tylenol is just one brand of acetaminophen. There are other brands of acetaminophen. So I'm not, Tylenol was thrown out there at the press conference, but you really shouldn't use those brand names. You should be using generic names, because that's just one brand. So if you're pregnant, listen to your OBGYN. And then when you're pregnant, that's the other thing. You use acetaminophen for other things other than fever. So I'm using Tylenol. Don't listen.
Last one, we always hear it keeps going up and down, alcohol. How much alcohol is too much?
So,
Oh.
So, in my current position, I'm doing cancer risk assessment, cancer prevention, cancer screening. I'm ordering mammograms and PSAs and Pap tests. We have now more definitive evidence that alcohol, including beer, increases your risk of cancer. So women, healthy and safe alcohol use for women is 7 drinks, no more than 7 drinks a week. A drink is 5 ounces of alcohol.
Not a sippy cup full.
Right. And for men, no more than 14 drinks a week. That is safe use of alcohol. However, binge drinking is also unsafe, meaning you can be under that, but if you're binge drinking, that's also unsafe drinking. So talk to your doctor about whether your alcohol intake is safe or not. But yes, the cancer risk is there. So when I'm talking to my patients about their cancer risk, alcohol is way up there, and we have that right underneath tobacco.
And finally, CBD, THC, gummies, anything in the category around cannabis. Depends on the state that you're in, of course, but what's your
So,
take?
so this is what I tell people, and people get a laugh out of it now. One, so far, we don't have any information about smoking and cancer risk. But, you know, we do have information we've known for a long time that those drugs can decrease your ability to lay down new memory. So I tell my patients that if you just want to be goofy and don't have no memory, okay, go ahead. But, so those drugs don't necessarily have a physical dependence, but you can have a psychological dependence on those drugs. So they're not benign drugs. Now, having said that, we've used those, and I'll say drugs, chemicals, for a long time for in the medical arena. So there are safe ways to use it. In my career, I have practiced in states where we do write prescriptions, orders, or however the state does it as far as people using medical cannabis. I'm okay with that, but there are people who those drugs, you can still have a substance use disorder from those drugs.
And there you have it. I told you, straight talk. Oh, one more question before we go, sir.
Yeah, I received what you said about don't go look up symptoms on the internet. But, what's your opinion about having the medical book, that tells you what skills are? The PDR, what's your opinion about letting people use the PDR to check behind what the doctor is ordering?
Yeah, I think the PDR is okay. PDR is physician death reference. Yes, yes.
prescribed for a second condition, how do you then understand the pros and cons of things that you learn in the PDR? How do you, and how does the drug know? The drug doesn't know that it wasn't being prescribed for the initial reason, so how do you sort that out? Is that
Yeah,
fair?
they follow the same, guidelines as far as taking the drug or stopping the drug on your own.
So that's something you obviously should talk to your doctor about. But we use drugs for a lot of different conditions, and sometimes different conditions that may seem different to you may work on similar pathways in the body, and so that drug is working for the condition that you have, but it also works for another condition that you don't have, so it doesn't apply to you. So yes, we use probably the drug that you're talking about. We use that drug for all kinds of things. In fact, a lot of times the drug that it initially comes is a drug can be started for one condition, and we find out it doesn't even work that well for that condition. But we find out it works better for something else 10, 15, 20 years down the road. Like minoxidil. That came out maybe 60s, 70s for high blood pressure. We don't use it for high blood pressure anymore. But they found out when people took it, it made their hair grow. So we use it to help people.
The GLP-1s,
Yeah.
diabetes,
GLP-1s, yeah.
they were for diabetes.
So, that's science. But yeah, check with your doctor, because sometimes a drug, especially drugs that use different hormone pathways, they may work on multiple conditions in the same way, that use the same chemical pathways that don't seem similar to you, but pathophysiologically they're similar. And how does the body know? Well, you have one condition, but you don't have the other one, so it doesn't need to know. The drug goes to the receptors it's supposed to go to.
So again, Dr. Bonita Coe, thank you. Thank you for your empathy, thank you for your wisdom, thank you for seeing it through our eyes, because we need that, and thank you